Okay, good afternoon. Let's move to the next topic, which is another diagnostic procedure used for diagnosing cardiovascular disorders. So next we have echocardiogram. So ano nga ba si echocardiogram? This is where we use ultrasound or sound waves to produce images of the heart and its tissue. So paano to nangyayari? In an echocardiogram, there are the different components. So number one, we have yung tinatawag nating transducer. What is a transducer? Transducer, ito yung handheld device, yung hinahawakan na device that is directly put on the patient's body or patient's chest. Ito yung dinidiin or ina-apply or nilalapat sa mismong dibdib ng pasyente. That is the transducer. Okay? And that transducer, siya yung nagsisend ng high-frequency sound waves sa katawan ng patient. And those sound waves will bounce back from the tissues of the heart or the patient's body pabalik doon sa transducer. Yun yung sinasabi nating echo. Okay, kaya siya echocardiogram. Magsisend ng sound wave towards the heart or the tissues of the heart of the patient, and then those sound waves will echo back into the transducer. And that echo, siya yung magproduce ng images that is seen on a monitor. Okay, nakikita yung images doon sa isang monitor. And along with that transducer and the monitor, there is also the use of a gel. Okay, may ina-apply na gel. Okay, now what is the purpose of this gel? Bakit kailangan may gel? Okay, number one, we already know this. Okay, yung gel, this is used for lubrication. Okay, para mas dumulas and mas madali yung pag-glide ng transducer sa katawan ng patient. That's why we use gel. But that's not actually the primary purpose of the gel. Ano ba ang gamit ng gel? Okay, this is to reduce the gap between the transducer and the skin. Okay, to make sure na mas accurate yung pag-transmit ng sound waves from the transducer into the patient's skin or into the patient's tissues. Okay, so kung meron mang hangin or any materials or particles between the transducer and the skin, it makes sure na yung gel is kino-close niya or okay, nire-reduce niya kung ano man yung pwedeng mag-impede okay, or mag-disrupt ng transmission ng sound waves between the transducer and the patient's body tissue. So yun ang function ni gel. Okay, so those are the primary materials that are used, and of course with the use of ECG. Okay, habang naka-echocardiogram si patient, they are usually attached to an ECG. Okay, so habang nag-echocardiogram ang patient, namomonitor din ang electrical activity ng kanilang heart with the use of an ECG which has already been discussed. So, para saan ba si echocardiogram? Ito yung mga common problems that can be diagnosed using echocardiogram. First, we have atherosclerosis. Ano nga ba si atherosclerosis? This happens kapag merong nag-accumulate or naiipon na fatty substances along with other substances sa loob ng blood vessels, particularly sa mga arteries, okay? Nagkikling sila or kamakapit sila sa wall ng artery. So for example, if this is an artery, okay, pag sinabi natin atherosclerosis, there can be fatty deposits, pwedeng cholesterol, and other substances na pwedeng magkling or kumapit sa blood vessels that can cause them to narrow or sumikit. Next, you have Next, you have congenital heart problems. When you say congenital, this refers to problems that have developed during pregnancy. Okay, habang fetus pa lang si baby or habang nagde-develop siya inside the mother's womb, that is when the problems occur. So that is congenital heart problems. Next, you have heart failure. What is heart failure? Basically, this happens when the heart becomes too weak. Okay, masyado siyang mahina, hindi siya nakakapag-pump ng blood ng maayos. Next, you have aneurysm. What is aneurysm? Aneurysm happens kapag nagiging mahina or nagwi-weaken yung walls ng blood vessels, causing it to, okay, magkaroon ng pouches. This is an example of an aneurysm. So this area of the blood vessel is weak. Okay, so yung dugo or the pressure from the blood that goes against that wall causes it to form a pouch or outpouching. So yan si aneurysm. Okay, now next you have heart valve problem. So we have 4 different valves in the heart. Okay, ano yung dalawang general type? You have the AV valves and the semi-lunar valves. Okay, so pwede niyang ma-determine kung meron bang problema sa mga heart valves. Next, you have cardiac tamponade. What is cardiac tamponade? This happens when there is fluid accumulation or merong naiipon na fluid in the sac that is surrounding the heart. Okay, so yung nakabalot sa heart, okay, na sac, this can pwede siyang mag-ipon or magkaroon ng accumulation of fluid. Pwedeng pus or nana, pwedeng tubig, pwedeng dugo. Okay, that is cardiac tamponade. And lastly, we have septal defects. What are septal defects? Basically, sa ating septum. Ano nga ba si septum? This is the tissue or the wall that separates the chambers of the heart. The chambers of the heart, you have the atria and the ventricles. So, yun yung mga pwede niyang ma-diagnose. Now, what are the common types of echocardiogram? Ano yung mga pinaka-common type? Okay, next. Okay, next tuloy. What are the common types of 2D echo? Common types of echocardiogram. First, you have, okay, Doppler echo. Okay? Yung Doppler echo, this is used to measure blood flow. Okay? Yung blood flow ang mini-measure with the use of Doppler echo. Kung paano mag-move yung dugo sa loob ng puso ng patient. That is Doppler echo. Next, ito yung pinaka-common natin. You have 2D echo. Ito yung madalas nating marinig. Or see, two-dimensional echo. Okay? In ang 2D echo, okay, yung view dito, this appears as cone-shaped. Okay, sa isang monitor, yan yung parang paganyan. Okay, ganyan yung view sa monitor. And dito yung images. Okay, cone-shaped siya. Okay, and this monitors the motion of the heart's structure. Okay, yung movement ng structures ng puso. Motion of heart's structure. Okay, and then you have 3D echo. Okay, and a 3D echo, from the term itself, 3-dimensional. Okay, so mas detailed. Okay, it could produce more detailed images compared to 2D echo. More detailed images. And then, of course, you have the M-mode echo. Okay, M-mode echo is the simplest form of echocardiogram. Okay, ito siya, more of tracing. Okay, more of tracing ang ginagawa sa M-mode echo instead of imaging. Okay, instead of actual pictures compared dito sa Doppler 2D and 3D. M-mode, very simple. More of tracing ang ginagawa niya compared to creation of images. Okay, so those are the common types of echocardiogram. Now, ano ang ating patient preparation or patient care when it comes to 2D echo? So, when it comes to 2D echo kasi, this is non-invasive. When you say non-invasive, okay, this does not require entry sa loob ng patient, sa loob ng katawan ng patient. So, that is non-invasive. It does not require entry inside of the patient's body. So, usually, there are no special preparations, not a lot of special preparations. Okay, ano ba yung ibig sabihin ng special preparations? Like, kailangan ba nila ng special diets? Kailangan ba nilang mag-switch into liquid? Kailangan bang NPO sila? Ito yung mga special preparations natin. So, ano ba yung mga importante lang na gawin natin when it comes to 2D echo? Okay, we have to, of course, health education sa patient. Ano ba yung mangyayari? Anong pwede nilang i-expect? Okay, ano yung pwede nilang i-expect during 2D echo? Okay, your 2D echo usually lasts for about a couple of minutes only. Hindi siya masyadong matagal and it is non-invasive. Okay, ibig sabihin hindi kailangang pumasok sa loob ng katawan ng pasyente. So there are no special preparations. But of course, you have to ask the patient their medication history. Ano ba yung mga tinik nilang gamot? Okay, and of course, yung prep nila for ECG. Na-discuss na natin kung ano ang prep nila sa ECG. Okay, same prep kasi mag-a-attach tayo ng ECG sa patient during 2D echo. Positioning. Ano ba ang position ng patient? They are usually positioned side-lying. Okay, and pag side-lying ang pasyente, pwedeng maglagay ng wedge or pillow, okay, sa likod, sa lower back, or sa hip ng patient as support. Okay? Okay, and then after 2D echo, usually they can resume their normal activities. They can resume with their normal diet. Wala talagang masyadong special preparations when it comes to 2D echo.